So Sue Chandler and Don Hayes from Dove are joining us here remotely to chat about how COVID-19 has impacted Dove Domestic Violence Ended and services that they're still providing and how you can also help them out. So ladies, good morning and thanks so much for spending some time to chat with us about what's going on at Dove. Great to see you both virtually.
Yes, likewise. Good morning, Joe, and all of our friends at QA TV and all the listeners and viewers. We hope everyone is safe and well.
Good morning, Joe. Good to see you. As always.
Yes, and hopefully we can do it in person again real soon. But in the meantime, we thought that there was some vital information, certainly, that we wanted to get out to the community. Sue, certainly to let folks know that Dove is still there and still very, very active in your mission, right?
We absolutely are. All services continue, albeit changed. We're doing all of our work remotely. And so definitely folks can still access services by calling our office number, 617-770-4065, extension 300, and leave a voicemail letting us know what you're looking for. If it's legal services folks are looking for, the extension is 400, and somebody will get back to you. Unfortunately, one of the things we'll talk about today, I assume, is that folks may be in need of emergency shelter. And right now, our shelter capacity is filled, and we don't have any space for callers, but we can see people through what we call our community or legal services through the numbers I just gave. We're definitely still providing services available to folks. So thank you for raising that.
Have you actually seen an uptick in cases of domestic violence since this crisis began, Sue?
We have not seen it in any noteworthy ways. What we know is that some of the police departments are getting increased numbers of calls to the home. And unfortunately, we think these are exactly the conditions in which domestic violence thrives and sexual violence, where folks are in isolation, ordered to be in isolation, where abusers can keep an eye on and keep control over victims and survivors' actions, their every move, basically, and can limit the survivor's ability to reach out for help. So even if somebody were accessing services through us virtually, it can be difficult to do so when you're stuck at home with an abusive partner.
And just imagine with the stress, just the stress alone, when you have an abusive personality, when they feel that they're losing their control, they're going to exercise more control in the areas that they can. So now these poor folks are trapped in their homes, and their abuser is generally right around the corner, you know. And I was listening to a NPR piece just before this call, and across the country, they've been noticing an uptick in police calls more so, and nationally, the domestic violence hotline has had less calls just because of some of the things Sue was talking about. So nationally, they're seeing a tick up from between 20 to 30% through the police departments. So.
Yeah, there are fewer calls because they're afraid, right, to make those calls. So they're going right to 911 essentially.
Yeah. Exactly. Unfortunately, probably at points when violence becomes extreme and they may be experiencing physical or sexual assault.
So are there some tips, some recommendations, some advice, ladies, for folks who are in that situation right now to at least try and quell it as much as possible?
Yeah. So it's definitely we can offer some guidance around some safety matters. The abusive behavior is conducted by the abusive partner, so victims aren't responsible when that happens and definitely can't control it. What folks can do is try to think about the pattern of the day. Are there times that seem to be more stressful? Are there ways to sort of mitigate that stress? If somebody were trying to reach out for help, potentially doing a call from your car if you have to run out to get groceries, or making a note that you want to take a walk at a certain time every day so it's not abnormal or unusual. It doesn't call attention when somebody does want to get out of the house for a few minutes and try to make that call. Those are some things to think about.
Great advice. Yeah, I think that's really key, to give them just some coping techniques until this crisis passes. For folks who may find themselves in a unique new situation where there hasn't been domestic violence in the past, I guess, what are some red flags? And then, if they do have those warning signs, what should they do?
That's a really important point, Joe, because, we want to support everyone and to support the community and believe people when they say, it's not always a joke when someone says something indicating that they're in trouble on Facebook or, your friends in your community. Believe them and support them the best way that you can. I didn't mean to step on you, Sue.
No, it's good. Well, typically, some of the things that we know are areas of concern, those may have to do with social interactions, extreme jealousy or isolation that can initially come in the forms of, I just love you, I want to be with you, all the time. And in this scenario, some of those indicators are changing, right? So, some of the high-risk indicators that we know about are sexual assault, strangulation, which people think of as choking, and threats to do physical damage, threats of physical assault, threats to kill, and just noticing that what we think of as a cycle of violence, so when things go from kind of the honeymoon, everything is fabulous and rosy, to tension building, to some explosive event, when that cycle becomes shorter in between and more intense during. And I think everything is sort of heightened, and we're in a new normal now. So paying attention, listening to your gut, really, really important.
And also things, not necessarily physical abuse, but you go out, and if you want to go out for a walk, when you come home, I'm not going to let you have the hand sanitizer, or I'm not going to let you back in. That's abuse. Things like that. Some people don't even think they're in abusive situations, but it's that control over that piece I mentioned on NPR.
Yeah.
They were talking about healthcare workers who are in abusive relationships who their spouses won't let them in the house. These are people, it's mind-boggling.
I had never even thought of that, but yeah, wow.
Yeah.
Well, even I guess relationships that are quote unquote healthy are under, different stress right now than they normally would be. So folks are probably trying to, work their way through those things where they're seeing so much of each other where they haven't in the past, even if they've been together a very long time. So it's like you say, it's all new ground.
Yeah,
absolutely. And then you throw a few kids into the scenario and, you've got, the pot boils higher and higher,
Sure.
Even in the scenario.
Yeah. What about, I'm thinking people are under stress financially right now as well. And isn't financial control also another form, or could be a form, I guess, of control or abuse?
Absolutely. It definitely is. And that may come in the form, again, typically we know abusers might track your mileage in your car or make you show receipts when you've gone out. That could still be happening.
Or give you an allowance, not even let you have your own money.
Could be not working cooperatively to provide a workspace. If somebody's working remotely, for an abusive partner to sabotage the victim's ability to do work and could threaten their job. Yeah.
Right. Who are you having that Zoom meeting with? Who are you talking to? That sort of thing.
I see. Yeah.
Insidious.
I have, I frequently am in touch with the Quincy Police Department, just in terms of gathering news and information. Fortunately, they have not reported any serious incidents at all, but they're wary of it, they're mindful of it, and they're certainly sensitive to it, so they're on the lookout for it. But
Yes.
so far, thankfully not. Yeah.
Yeah, we do anticipate when the some of the social contact, when we take our feet off the brakes a little bit and allow folks to be back out in the world a little bit more, that we're going to be hearing from a lot more victims who've been silently experiencing really horrendous abuse.
Yeah. I'm assuming your emergency hotline is still up and running? Is
It
that
is,
right?
yes.
Okay.
Yep. And that number is 617-471-1234. Or, Don, help me out, 888-314-3683.
3683.
Phew.
Thank you.
ELP.
Like, oh no.
So yeah, again, it's 888-314-3683 or locally 617-471-1234.
Yes.
Okay. And through the website also, is there a way to email perhaps or reach out to the website?
We haven't yet set that up, but go ahead.
You can email to development@dovema.org.
Okay.
And we will get whatever the question is, we will find an answer for it.
Okay, great. I think it's important to point out your administrative offices are closed right now, right?
Yes. Yep. Our community services office, where the administrative functions are housed, are closed. I happen to be here today, but yes.
Right, just in case folks are looking, to reach out in that way, it's not available right now.
That 617-770-4065 number goes right to a voicemail that we check regularly.
Okay, good to know. Don, we should talk a little bit, I guess, about, Dove is a nonprofit 501c3 organization that exists largely on donations, of which I'm sure are down right now.
Absolutely. We're in a tough spot. Our annual Divas Dance, which is just a jewel in the community, is going to be virtual this year. So we are creatively trying to find ways to raise money.
Yeah.
We depend heavily on Divas Dance and Harvesting Hope, our two big events, for supporting the organization. And we're taking a big hit right now. So I encourage the community, if you're watching, to please consider a donation to Dove. And Joe is going to put up the link where you can help us. So we're working hard to raise money. So Divas Dance is going to be virtual on June 11th. We're still looking for sponsors. It's going to be a dance party. People have gotten incredibly creative with having online gatherings and parties. So we're working really hard to making it a festive, happy, joyous event. We'll be able to have upwards of 250 to 500. We're still people on Zoom, which is amazing when it's done well. And we're really going to find a way to have it be very well produced. And the tickets are going to be $20.
Okay.
So it's a cheap entry to support an organization that does so much for the community and for the people we serve.
Yeah, I'm in my mind, I'm picturing like a giant 72-inch flat screen television with hundreds of people dancing in their
right?
squares. Yeah, exactly.
We can go national.
It can. And a fun thing about it is if you get creative on Zoom, you can put a green screen, pictures behind you.
Yep.
The Tiger King is popular now. I went to one of these a couple of weeks ago,
Yeah.
and I was amazed at the creativity. You've got moms and their babies dancing,
Yep.
and just lots of movement and joy. And at least for Dove, it's something that will go to a really good cause.
Yeah, we should talk about what the funds raised are used for.
They're used to support our programs. They're used to help our clients with items that they need. Sue, what other, I'm blocking right now, but what other?
So they directly support all of our programs, our emergency shelter operations, community services, legal services where we help people with restraining orders or family law matters. immigration matters, housing and benefits. Also, our police-based partnerships with 8 different police departments in Dove service area, and children's services, direct clinical intervention with children, as well as our prevention-oriented youth programming, community education and prevention, that where youth learn about healthy relationships, dating abuse, bystander intervention, and can, in their own schools and communities, get actively involved in conducting that education and intervening where help might be needed.
Yeah,
Sure.
and other uses are where grants don't cover, because these are unrestricted funds that we're trying to raise right now with you folks. And so it really helps fill in the gaps as well.
Sure. So to that point about restraining orders, what is the situation now in the family court system if somebody finds that they need one, or maybe one is expiring or something of that nature?
Yeah. So typically restraining orders happen in the district courts, and Quincy District Court is one of the district courts in our area where there's historically been a Friday morning domestic violence focused restraining order session. The courts are conducting emergency hearings and can still issue restraining orders. There's more happening through police departments now for that. So the local police department is a good source of information, or our civilian advocacy line. That civilian advocacy phone number for Dove is 617-653-4226. And our staff member can provide more information about what's happening with restraining orders through that line.
Okay, great. We'll get that out there for more. What is currently Dove not able to do under this situation? What are some of the programs and services that aren't happening right now?
So I would say the biggest thing that's not happening is our support groups and gatherings that we were having.
Right.
Of lots of folks. We really have an amazing community of folks who come together in different ways, whether it's weekly, bi-weekly, or monthly, sometimes to prepare and share food together. We bring in activities. We've had some Reiki in the past, or people bringing in their different skill levels, crafting, making craft books, children's activities, children's group activities. And so some of the support groups were pivoting a little bit and able to do some of that virtually. I think more of that will come in time. But that's probably the biggest loss, is the gatherings of folks where people aren't necessarily even coming together to talk about domestic violence, but have a shared history and are looking to focus on and celebrate other parts of their lives as they can shelve the history of domestic violence a little bit and reclaim their whole selves. That is probably our biggest loss as a community of Dove's community.
And 2 of our groups are specifically for survivor empowerment. One is called Bloom and one is called Voices. And as you said, they do all of those wonderful activities. That's not just about being a survivor, but showing how powerful they are. And some of them have some amazing skills and abilities. So yeah, it's when you're at the office and you smell the food cooking and you see kids running around, it's really, I'm sad to not be there. It's a magical space, and it really makes people feel really good.
Sure. In addition to, funds, how else could someone help right now in terms of, donations or volunteering or something of that nature that they might be able to help Dove with right now?
Yeah, some specific things that we are in need of right now: gift cards to grocery stores or CVS, so Target, CVS, Shaw's, Stop and Shop. Those would be immensely helpful, because we do have a lot of people who are financially in difficult situations that we're trying to share resources with. Also, we anticipate, given the public health information that's coming out, that this social distancing is going to go on for quite a long time. Again, maybe putting on the brakes sometimes and then loosening up. But we would welcome donations of masks. So either disposable masks, or if folks are at home and able to sew some fabric masks that have an insertable area for a filter.
Mm-hmm.
So folks can wash those and reuse the masks. We imagine that staff and clients are going to need those over the course of the next 12 to 18 months, sometimes more than others. So that would be a great project. Somebody called last week. Their daughter was looking for a Girl Scout project, and unfortunately I didn't have that on the top of my mind at the moment, but now I do.
Sure. Okay. And how would they get those donations to you, Sue?
They could mail them to our P.O. Box, P.O. Box 690267 in Quincy, 02269. That address is available on our website, which is www.dovema.org. That's probably the best way. Or they could call and leave a message at the 770-4065 extension 300 number,
Mm-hmm.
or send.
You could also email development at dovema.org.
And then
Okay.
we could make arrangements for a drop-off
Okay.
a safe way.
Yeah, obviously, right. The social distance way, right? The
Yes.
new normal, yeah.
The new normal.
Yeah. I'm just thinking, you mentioned kids, and of course, I mean, a respite for children who might be in a domestic violence situation normally would be they go to school, right, and get away from it for a while. Not going to happen now until at least May 4th, and maybe longer than that. Who knows
Yeah.
at this point? Is that a concern?
Absolutely is a concern. And our children's services specialist, Jill, is doing Skype or Zoom meetings with children, and has a lot of activities she's doing with youth of lots of different ages. She sees youth between ages of 2 and 21 and has lots of different activities, also support for parents who are supporting their children. And we know that being out in nature is critically important right now. So again, being mindful of social distancing and public health guidelines, if folks can get out, get some sunshine, fresh air, some physical activity, that those are really important.
It makes a huge difference. It makes a huge difference.
Absolutely. In the next couple of days, I think it'll be conducive to that. So
Yes.
put that to good use for
Yes.
sure. If you do think of anything that we didn't touch on, reach out, and we'll do another one for sure. This is
Great.
no limit to this, so I'll be happy to do it for you.
Thank you so much for reaching out to us.